want to especially welcome our team and our presenter that we have for today's COVID-19 One Health webinar, Emily Hirata. Emily is well known to those of us in the ADRA network because she has been working very actively in our Health Technical Learning Lab, and she is has been a member of the ADRA international team for I don't even know for how many years, certainly longer than I have been. So I am really pleased to welcome her and to have her as part of our webinar today. Emily has a very wide portfolio in the work that she does with ADRA. Not only is she a technical advisor for health and nutrition, she also has a long-standing interest in One Health, and she's going to explain what that means as part of this webinar. She has had a lot to do with One Health, and she's presented at the World One Health Congress. She's a member of the Washington DC One Health Academy, as well as being a member of the core group of One Health Interest Group, and she's been a participant at the International Student One Health Alliance. She's also completing a Master in Science in One Health, which she hopes to complete in June 2021, and she's currently working on her dissertation or thesis, amongst all of the other things that she is working on with ADRA. So I just want to remind each of you that we are going to be recording this webinar, and we will send out the slides and the webinar recording to those who have registered, and it will be available through the Health Technical Learning Lab Community of Practice group. So for those of you also who have questions, you are welcome to put those into the chat box and we will address those. We are also going to be splitting up into breakout groups and using breakout rooms. So we do have a series of questions that we have the opportunity to discuss and share in the breakout room. So looking forward to hearing your questions and your feedback, and also looking forward to hearing about what Emily will present. And I'm just going to hand it over now to Emily. Thanks, Emily, and welcome again to you.
Thank you, Victoria. Can you hear me okay?
I can.
Perfect. Okay. So yes, today, first of all, good morning, good afternoon, good evening to everybody where you are in the world. We're going to talk about COVID-19 and other pandemics today. And specifically other pandemics that have become front and center at the human-animal environment interface. So this has recently been touched upon in the news and in research recently, but we thought it might be a good idea to highlight it for practitioners in our field of work as well, international development and relief, since there are actually some very good ways that we can be involved with it. So as Victoria said, this is me up on the slide. For those, I wanted to put this in here for those who aren't familiar with who I am. And as Victoria said, you know, my passion really lies in One Health specifically. But I will say right off the bat, I don't claim to know everything there is to know about One Health, because, you know, as we'll see, One Health is all about collaboration in different fields. So essentially there's no possible way for anyone to know all there is to know. But with that said, I do want to share what I am aware of, what I do know, and how taking a One Health approach will be more than necessary if we want to prevent similar pandemics in the future. Okay, so before we dive in, here's a quick overview of what we're going to cover today. We have just 3 main sections to this webinar. First is, what is One Health? Plain and simple. Then how is COVID-19 a One Health issue? And then finally, what One Health actions can ADRA do to prevent similar future outbreaks? So basically, I'll be giving an overview of these three subtopics, and then we will, as Victoria said, we will break out into smaller groups to have some further in-depth discussion later on at the end. So first, what is One Health? Now our ADRA Health Technical Learning Lab actually has done a webinar several years ago that specifically goes into depth on One Health, what One Health is. So I won't go into too many details here, but I will cover the main idea of what it is. And it's not a new discipline, it's not a new sector, but rather a new perspective or a new approach, as some people might call it, on how we deal with the health disciplines we've been studying and practicing in for centuries. So generally speaking, when we think of the term health in international development or relief, you know, our context, the space where ADRA is present and active, we mainly think of the health of people. Global health typically constitutes a focus on human beings, where we look at what affects our health and why. And we have subsectors of this, of course, you know, such as human nutrition, medicine, epidemiology, maternal child health, reproductive health, you know, etc. You get the picture. However, there are also other fields that also deal with health, just not of humans. Veterinary health keeps animals in the focus, where we look at the, you know, what affects their health and why. And so that includes veterinary medicine, livestock care, wildlife conservation and welfare, those types of fields. But there's also a third field, what we call ecosystem health or environmental health. And that focuses on the health of the natural world around us, the health of the planet, what makes it thrive and what makes it die. And this includes areas of study such as rainforest conservation, ocean preservation, plant pathology, ecology, those types of fields. So really, when we think about it, there are several different kinds of quote unquote health that exist. Health isn't just found in humans. Now with the One Health approach, these three branches are all looked at together and are more equal in importance. So traditionally, health in international development is very siloed. And I know we do have agriculture that looks at animal health, and we do have a look at environment in a certain way, but those normally don't fall under what we typically think of as health. You know, it's very siloed in our field. But the One Health approach really blends these three branches together, and it's just one big picture of health, not separating the people from animals from planet. It's not three different healths, it's one health, hence the name. Now, there are a number of different variations to the definition of One Health, but I really like the way the CDC here in the United States describes it. And they put it this way: One Health is the idea that health of people is connected to the health of animals and our shared environment. Now, this last part here is key. When we protect one, we help protect all. So essentially, this is the reasoning behind why One Health is so important. All three of these branches are extremely closely connected. So breaking this down a little bit further, what this means is that when we protect planetary health, you know, our natural shared environment, we're protecting the health of people and animals within it. For instance, as a very simple example, if we protect the planet through measures to reduce air pollution, people and animals that breathe that air will have healthier lungs and less risk for respiratory disease and, you know, morbidity, mortality even. Or, as another example, if we protect the health and habitats of wildlife, we will help protect the health of people in the surrounding communities near that wildlife that may be able to catch bacterial or viral infections from those animals. So that's a very brief description, a brief overview of One Health. There's a lot more to it, but the main idea is that health is connected between humans, animals, and the environment. We're very interlinked. So let's transition a little bit because this is a COVID-19 webinar. Let's talk a little bit about the coronavirus disease 2019, as we all know as COVID-19, and just how it is a One Health issue. Now, what we have to remember here is that this virus, the virus that causes COVID-19, has never before been seen in people up until this current pandemic. Never been seen before. So, in other words, this virus didn't come from other people. It didn't start in people. So that brings me to zoonotic diseases, otherwise known as zoonoses. And these show us how closely connected our health is to the animals and the environment around us. So essentially, the simplest definition of zoonotic diseases is that they are diseases that can be transmitted to humans from animals, plain and simple, but to humans from animals. And this can be from pets, from livestock, from wildlife, any kind of animal. Now, what's incredible is that for all infectious diseases in humans, over 60% are of animal origin. Over 60% of all infectious diseases in human beings come from animals as a original source. And of emerging or new diseases that we see affecting humans, such as COVID-19, over 75% are of animal origin. That's incredible. Over 60% of all infectious diseases in humans are from animals, and over 75% of new diseases specifically are of animal origin. So with these numbers in mind, it gives pretty clear indication that to be protecting the health of people all across the world, we actually need to be paying very close attention to the animals around us and, within our shared environments. Why? Because some of these zoonotic diseases that really wreak havoc, they really wreak havoc on the human population. So to give you an example, these are some zoonotic diseases that have wreaked particular havoc in the recent years. And we all are probably very familiar with most of these. So we have the SARS epidemic in the early 2000s, the H1N1 influenza swine flu pandemic, the West Africa Ebola crisis. That was huge, a very big deal. We have the MERS outbreak in the Middle East. If you're in South Asia, the Nipah virus outbreaks are quite a big deal. In the Americas, we have Zika, the Zika epidemic, and then we also see here that COVID-19 also falls within this list. So remember, most emerging or new diseases in humans come from animals, and this novel coronavirus that causes COVID-19 is no different. It indeed does have an animal origin. Now, something really important or interesting I find here to point out is that this pandemic that we're now experiencing has come as no surprise to those working in the One Health space, practitioners, scientists. It is no surprise because of the way things have been going, and we'll talk about that in a minute. But because of the way things have been going and how the trend of new diseases from animals has been on a steady increase, and our influence over the environment, this was predicted years ago. Some of you might be familiar with the term disease X. This is this is filling that space of disease X. This was predicted years ago. So it wasn't a question of if, but more a matter of when. And we'll talk a little bit more about that in a minute. But back to origin. So what is the animal origin? Where did this start? You may have heard some conflicting answers about this, but snakes were originally suspected, but since then we've had some more concrete studies suggesting that either pangolins or bats, as you can see here up on the screen. And while we don't know for sure yet, currently research suggests that bats are the most likely reservoir for the COVID-19 virus. And this is because the virus that causes COVID-19 matches extremely closely with a bat coronavirus circulating in a specific species of bats, Rhinolophus bats, I believe is how you pronounce it. They're otherwise known as horseshoe bats. And so the virus matches extremely closely with a bat coronavirus in these particular bats, and shares over 96% of genetic material with it. So very closely linked. But with that said, most of the research suggests that people didn't catch the virus directly from bats. So while it may have originated in bats, we likely did not actually catch it from bats themselves, but rather through an intermediate host. So essentially the idea is that it jumped from bats originally to another animal and then to humans. So, and we're not quite sure what kind of animal this is. There are different theories going on, but the main idea is that it's jumped from bats to another animal to humans. So what kind of setting, what kind of environment could allow for this virus jumping? In this case, the most likely culprit is wet markets. It's suspected that the COVID-19 outbreak started in a wet market. And for those unfamiliar with the term, a wet market is basically a type of fresh food market. It's known for selling fresh produce and other different kinds of fresh foods, including fresh meat, as well as, in particular, live animals. And the reason wet markets are suspected for this outbreak is because, according to a Lancet article, the Lancet is a very prestigious journal. According to a Lancet article from February, 66% of the first reported human cases of COVID-19 had direct exposure to a specific wet market in China. And this has led to the idea that spillover from animals to possibly another animal and then to humans took place there. Now, I want to give you a little warning. The next slide is a little bit graphic. So if you're eating breakfast or you're specifically, you're a little bit more of a queasy person, you may not want to look at the next slide. But here it is. I wanted to share a few photos taken from across the world of wet markets. And I do apologize that some of these photos are a little gruesome, but they're not included in this presentation to gross you out or to make you sad or shocked. And they're certainly not here to give us reason for placing judgment or blame on those that work in or shop at wet markets. I do want to be very clear about that. But what I wanted to depict here is just how easily viruses can jump from one species to another in a wet market or similar setting, as opposed to out in the wild. So in wet markets, it can be very common for different species to come into very close contact, most of the time, which would never happen in the wild. So for instance, look at the middle top picture. The cages of two completely different kinds of animals are right on top of each other. The top being some kind of groundhog or other rodent, and the bottom some kind of deer-like animal. So it's more than likely that such close contact of these two species isn't natural. And the significance of this is that viruses that one species may normally carry, but that the other doesn't, have the increased opportunity to jump species. So even if the one species is carrying a virus that doesn't make it sick, so say if the groundhog is carrying a virus that doesn't make it sick or cause it to show any symptoms or anything like that, it still very well could pass to the other animal below it through a sneeze or maybe blood or urine leaking from the cages. And that can make the other species extremely sick, you know, sometimes, because as we know, as we have seen with COVID, different pathogens can affect varying species quite differently. Similarly, look at the tables on the top left, as well as the big photo to the right. You'll notice that there are several different species of animals on each of the tables. Many that are probably not so close together normally in the wild. So my point here is that as these species come into closer and closer contact in these settings, frequently under stressful caged conditions, which sometimes can increase viral shedding, it makes it very easy for viruses to spill over into other kinds of animals in a way that would never happen in the wild. Even in cages, even for cages full of the same animal, such as the bottom left with the birds, with lots of crowding, just one sick bird could infect all of them. And, you know, if there are other cages of animals, it looks like there's another cage right below them, you know, that can spread even more. So as unique epicenters for transmission of viral pathogens, potential viral pathogens, wet markets have particular potential, not only to create never before seen diseases in new species of animals, but also in humans. And hence, this is how COVID-19 is suspected to have jumped species and spill over to us humans. So already we can see that COVID-19 is it's clearly a One Health issue, particularly connecting humans and animals. It's similar to that of coronavirus diseases, such as SARS and MERS. These are very closely related to COVID. SARS was connected to bats and civet cats, and MERS was with bats and camels. And both of these diseases have also jumped to humans and can make us sick as well. And what's especially interesting about COVID is that there's growing evidence that viral spillover can take place not just in the direction from animals to humans, but also from humans back to animals, as we've seen with a small number of pets around the world, like dogs and cats, but even with some wild animals, such as lions and tigers in zoos, you know, with all these animals being infected with the virus after having close contact with a person with COVID-19. So the interesting stuff, it's got the ability to jump back and forth between species. So that was a really quick overview, really quick run through of what One Health is and how COVID-19 fits in with being a One Health issue. So the big question for us is, what can we do? You know, while ADRA is currently responding to the COVID crisis all over the world, it's important to recognize that it's not only a matter of time before, or it is only a matter of time before another pandemic of similar nature hits. As you know, again, as I said, this was predicted long ago, and if things just continue the way they have been, it's just a matter of time. So what can we as ADRA do to help prevent similar outbreaks in the future? If we know that zoonotic diseases are extremely common, remember 60%, and that 3 out of 4 new diseases come from animals, it's very likely that similar outbreaks are just going to continue. So, and you know, some of them can be devastating, not just to our health, but also to food security, livelihoods, travel, you know, education, trade, you name it. We're seeing this now. It affects all facets of our lives. So what can we do? According to Peter Daszak, who is a disease ecologist, he's also the president of EcoHealth Alliance. He's a very well-known leader in the One Health space, the One Health community. He says, pandemics as a whole are increasing in frequency. It's not a random act of God. It's caused by what we do to the environment, us people, us humans. It's not random. It's caused by what we do. So essentially, without a fundamental shift in how humans interact with animals and our environment, the next pandemic is only a matter of time. And according to scientists there at the EcoHealth Alliance, some of the top drivers of zoonotic disease spread are 1, deforestation and land use change in formerly forested areas, deforestation. 2, dense human populations, especially where these are growing rapidly. And 3, interactions with wildlife. So deforestation, dense human populations, interactions with wildlife. These are all seen as the top drivers of zoonotic disease spread. And although these are not the only drivers of zoonotic outbreaks, if they are some of the top ones, we may want to consider programs that deal with these areas, that address these. So for instance, programs that deal with environmental conservation and urban health and wildlife welfare and surveillance. You know, while ADRA may not be as experienced in some of these areas, we can still collaborate with partners that are. And, you know, these on the screen here are just examples. It's well known that human encroachment into untouched forests and ecosystems spur the spread of disease. We know this. So if that's the case, if we know that this is a top driver for disease spread, possibly environmental conservation programming could actually help prevent zoonotic spillover by keeping habitats with unknown viruses protected and away from human activity, rather than becoming a gateway for diseases to reach people and spread further and further. Through urban health programming, we can prevent zoonotic spillover and impacts of outbreaks by providing communities the knowledge and tools they need to withstand and prevent large outbreaks should viruses land at their doorstep. You know, as we know, urban settings are oftentimes very crowded, and sometimes people live under very poor conditions in these crowded spaces. You know, we as ADRA, we see this all the time. We see crowded living conditions, people with poor health in these conditions, and it's obvious that this makes for the perfect recipe for infectious disease to spread rampantly. Or we think of the wet markets we just talked about. Urban health programming could actually help with improving these conditions to avoid such viral spread and spillover. So urban health is extremely important. And through wildlife welfare and surveillance, you know, that kind of programming, we can prevent and be prepared for zoonotic spillover by understanding that what affects wild animals and their health may actually have the potential to affect ours. For instance, there's an estimated 1.7 million unknown viruses lurking in wildlife. So, that's a lot of viruses we don't know about, we haven't really studied, but that's the estimated number. So keeping an eye on how wildlife are doing, wildlife surveillance, protecting their health and welfare, keeping an eye on them can actually protect us in the end, especially if it's the kind of wildlife that people come into contact with often through hunting or through poaching, or even if even the kind of wildlife that maybe livestock come into contact with, and then that can act as an intermediate host for some kind of pathogen to reach you. So again, these are just some examples of areas that could be intervened in. And I really love how the UN Secretary General Antonio Guterres put it when he said, "To prevent future outbreaks, countries need to conserve wild habitats, promote sustainable agriculture, strengthen food safety standards, monitor and regulate food markets, invest in technology to identify risks, and curb the illegal trade in wildlife." If you notice here, this is not just about health anymore. It's most of these things that he states in his in this quote here. It's not direct health programming. We're not, it's not working in hospitals or something like that. It's not just about health, but it's about a more holistic well-being of people and animals and the environment altogether. And this is why it's so important for more than just health professionals to be involved. That's why we're all here on this call. Not all of us are health people, but it's why it's so important to work together, because it involves so much more than just the health field. So clearly, One Health involves collaboration. Zoonotic diseases essentially have come to exist because of the blending of different disciplines, different areas, if you will. That's why they exist in the first place. So in order to mitigate future outbreaks, we must take a truly collaborative and blended approach to interventions that seek to attain optimum well-being for people, animals, and the environment altogether. If we focus on just one of these areas, that imbalance will come to impact us for too long. And that's why we're seeing that's why we're experiencing what we're experiencing now with COVID. The American Public Health Association puts it really well in this quote on the bottom left corner, by saying that the pursuit of understanding human, veterinary, and environmental health issues separately leads to an incomplete understanding of disease risks, and therefore missed opportunities for mitigating and adapting to these problems. So again, it's about collaborating together, combining our disciplines of study and professions together to have a more complete understanding of everything that goes into, how a disease comes to be, how it spreads. Just again, consider COVID-19 and everything that it's affecting. It's truly about a more holistic well-being approach, and that's what we need to address further outbreaks of similar nature. We need to be collaborating well beyond health alone. So with that, since One Health is all about collaboration, we are now going to get into some smaller breakout groups to collaborate together. And this is just going to be a short exercise. We're not asking you to come up with concrete steps or anything like that, but this is really just to discuss and have a further conversation about potential ADRA-based solutions to preventing similar future outbreaks with a One Health lens. So, potential solutions with a One Health lens. And this you know, let's keep in mind some of the COVID-19 aspects that we've just talked about. And we can even discuss in our breakouts, you know, not just future outbreaks, but this current one. What One Health actions can we take considering everything that we've just talked about? So each group will have a facilitator. I think we're going to break up into 3 groups, and we're going to work through some questions with you. So please speak up, please participate. This is your time to share what you know. And you know, again, One Health is all about different disciplines coming together. So everyone's input here is important. So please speak up, please participate. We'll have about 20 minutes, and then we'll come back together at the end, have about 5 minutes for each group to report out for a few minutes, and then we'll go to Q&A. So Carrie, I think you can now place everyone into their breakout group.
Sounds good. And just before I do that, you will be automatically put into a breakout room. If you are not, I will help you with that. And if you need to come back to the main room where I will be at any time, you can. You'll have that option to do that, and you can let me know if you have an issue. With that, I'm going to put everyone in the rooms.
Okay, Yosue, would you like to start with your breakout session and share a brief summary of what you discussed?
Thank you, Victoria. Yes, so we had a very active discussion in our group about the 3 key questions about current projects, about partnerships, and about the challenges, obstacles, and also solutions. So we came up with a few ideas, like agriculture projects, for example, livelihood projects can consider these topics because they have a lot to do with the environment. And in fact, there are many governments now requiring that the projects they support make sure that they protect the environment, especially when it comes to agriculture projects, and I would say infrastructure as well. So that is an area where we believe we can do better in next projects. ADRA India has shared also a positive experience they are having in the current response to the pandemic. When it comes to, they are active on RCCE. So, and they have a One Health approach incorporated within it during, for example, their messaging campaigns. So to consider animal well-being as well, and to consider other things regarding One Health. When it comes to partnerships, there is great potential, and we believe it is important for ADRA to seek partnerships, alliances with organizations that have expertise on the subjects that can complement our expertise, like environmental issues, for example, organizations that are focused on the environment, and also organizations that deal with animal health. So by seeking those partnerships, we can really build on each other's strengths and have a better outcome for the target population or the target area where we work. In terms of challenges, and there is more about partnerships. I'm sorry, I'm skipping an important part, which is cooperation with the SDA Church health institutions, not only health, but also educational institutions like universities, colleges. We believe there is potential to approach them and to discuss specific efforts when it comes to prevention. For example, when it comes to the church also promotes a lot of, for example, lifestyle related projects, interventions, campaigns, and other types of efforts regarding prevention. So there is an opportunity to explore partnerships in that regard. When it comes to challenges and potential solutions to those challenges, the proposal design process is definitely a challenge that we see, because usually it's very rushed. Usually there is not enough time to even think about what we can do or can't do. We just focus on the priorities that are being required by the donor. But that is something that we need to address. Then there is also the usual thinking that whenever there is an emergency like now, or almost in every case this happens, that people usually think more about treatment or the current response rather than prevention. But we can advocate that prevention is always cost-effective, more cost-effective than dealing with responding to an already existing problem. Another challenge that we see is lack of intersectorial coordination, which seems to be a challenge in this case and has to be addressed if we want to accomplish better results. Donors are not always aware about the connections and the implications that were just discussed and presented by Emily earlier today. So I think as much as possible raising awareness with donors and with governments in general, we can say, it is very important. So whatever we can do to raise awareness about these issues and the connection between human health, animal health, and the environment. We found out a good experience as well, a good positive case that the French government has taken One Health as one of their priorities, and they have even launched recently a funding opportunity for that, which ADRA France has been considering to apply for. So there are opportunities like that, and we could prepare ourselves to pursue those opportunities. Sharing funds or sharing costs internally and even between or among country offices is another opportunity that we see to foster the One Health agenda as well. So those are some of the main points that we came up with. Back to you, Victoria.
Thanks very much for that, Josue. And while I'm going to share from the breakout session that I was facilitating, but I just want to remind any of the participants in this webinar that you are more than welcome to write any questions that you have into the chat box, and we can have the opportunity to answer or ask those questions and answer those questions at the end of the webinar. So our breakout session talked quite a bit about the sort of projects that we have funded. Like ADRA Korea had an example of a project that they are supporting in ADRA Ecuador, where they are supporting Venezuelan refugees, and that project has a livelihood component where they are using hydroponic irrigation to provide vegetarian-based options or plant-based options for food for the refugees, and in that way there would be less demand on land, therefore less demand for deforestation techniques, and also less demand on animals as a source of food. And then in Slovenia, there is also a project which is promoting specifically plant-based diets as a better form of nutrition, and those are types of projects where we would be able to incorporate One Health quite easily. I know also that other countries in the ADRA network are very heavily focusing on sustainable agriculture, specifically that would have a positive impact on land use and a reduction in the requirements for deforestation and providing a positive alternative. In terms of challenges and obstacles for One Health, I think there is quite a gap, and this was raised by one of our discussion members, a gap in the understanding of what One Health is. And obviously, this webinar is seeking to address exactly that, but that wider, maybe within the ADRA network and in a global sense, having a better understanding of what One Health is, and also promoting it positively, because many people, as was raised in our group as well, may have some nerves about the idea of protecting the environment, perhaps, that has some negative connotations, some unknowns, some fears, that may take away, environmental needs may take away from other needs that could be more urgent. So Sharon, maybe we can pass it over to you to provide a brief summary on what was discussed in your breakout room.
Okay, thank you, Victoria. Yes, we had a good discussion in our breakout room, and a few projects were mentioned, and I'll bring them up where the comments make sense. But looking at question number 1, current projects and how they could have been designed, things to consider next time. Some ideas that came up were to look beyond a do no harm to more of a net positive approach. And an example of this would be, rather than only focusing on fertilizers, for example, consider how to improve soils, or look at what might be the byproducts of different livelihoods that we might be promoting. For example, is water and air going to be affected? So trying to take a broader view. Another great idea that came out was that we have a number of multi-sectoral programs in countries, but the connections among the sectors needs more emphasis and more coordination. I heard this also coming up from Group 1, so it looks like great minds are thinking alike. And then there were some specific examples where, for example, there have been livestock projects, and looking at working with beneficiaries to safely market the livestock. Another great example that came up in this part of the conversation was even looking at our own ways of work within our offices. Could we design our projects to have less travel? And we've actually learned through COVID months that we don't need to have as much travel. Can we make deliberate plans to pollute less through air travel and fuel being used in vehicles in our upcoming work? So going to the second section, we had some examples of partnerships that the other participants might be interested in. And one is the Savory Institute, which ADRA offices in Asia have been doing some pilots with them. This group originated in Colorado. No, they actually originated in Zimbabwe, but they have an office in Colorado now. But their work is on sustainable livelihood partnerships, so that's something you may want to look into or talk to ADRA Asia about. Another partnership that came up is that many ADRA projects have community volunteers, and some of them are health, some of them may be veterinary, but there are ways that we could use these community volunteers to link some of our activities together. And we had an example that was given here from northern Kenya, right on the border with Somalia, with some diseases of high impact like anthrax that can be passed from livestock to people. And another partnership that was shared was partnering with epidemiologists or health scientists as part of agriculture projects that deal with selling and raising livestock. So then going on to the third area, I think we all agree that one of the great challenges is finding funding for One Health, although I think we can incorporate it into some of our multi-sectoral work. The donors may not recognize One Health necessarily, since it's an evolving approach. And of course, we have to deal with competing priorities from donors who might be very, laser focused on one particular sector. Some other solutions that were brought up here was the whole concept of stewardship, and our stewardship of the environment, transition to natural gas machinery and some of our agricultural projects in particular, but this could also, I assume, be in other sectors. The whole idea of using nudges that for small changes that together in the aggregate can make a difference. Another great suggestion that was made is working with children, because sometimes it's easier to prepare the next generation than it is to make changes in the current generation. So having those kind of educational opportunities built into our projects could be very important. And it was also noted that the whole idea of One Health is very compatible with our current network strategy, and some of the flagship programming that's described there that works across sectors would be an ideal way to integrate One Health. Back to you, Victoria.
Thanks very much for that, Sharon. Thanks, Josue. It's now time for us to get to the question and answer session of our webinar. We've got a couple of questions here. Emily, what would you say is the virus and human animal treatment? Would you say, is the virus and the human animal treatment just a problem for the global south? In Western countries, we do have the environmental movement right now, but this is more related to climate change. Where do you see ADRA's position in the global north? So perhaps we could split that into two parts, Emily. What would you say is the virus and human animal treatment just a problem for the global south?
Thanks, Victoria, and thank you everyone for participating in the breakouts. I learned a lot, things that I don't normally think about. So thank you so much. That was the whole point of this exercise, to collaborate and discuss these things together. For the question, it's absolutely not just for the global south. This is a global problem. A lot of what we do in the global north affects, especially when it comes to One Health, affects the global south. And it's, what's interesting is there are countries that actually have One Health policies. I know we learned a little bit about ADRA France earlier, that seems to have something going nationally, but there are countries in over the globe that have One Health policies in their national governments, and many of those are actually from the global south. And yes, there are some from the global north as well, but it seems like there's more focus on One Health in the global south. It seems like the global south gets it a lot more. And so there seems to be an imbalance a little bit, and the global north is absolutely just as I don't want to say guilty, responsible, I guess, just as responsible for taking these approaches to heart, for implementing this kind of approach, because as we know, we are a global, like our world is so globalized now. It's so easy to travel back and forth, for instance. Look at how easy COVID has spread. You know, this current pandemic, it hasn't even been a full year, and look at how many people have died and have become sick. So it's not just an issue for the Global South. This is everybody. Everybody has a responsibility.
I think you're right. The COVID-19 pandemic has really made it so apparent that the world is so interconnected, and the way the virus has moved around has very much highlighted that. Thanks, Emily. So in Western countries, we do have environmental movement, but this is related to climate change. Where do you see ADRA's position in the global north?
I mean, so climate change is actually a very big part of One Health as well. So I know this is, at least in the United States where I'm based, climate change is a big hot topic. It's debated in politics and all kinds of things. And if, you know, that's one way that, you know, the global north might, that's an area where the global north might want to latch on a bit more. But, you know, again, we all have a responsibility. It's not just nations as a whole, you know, at a large scale, but down to the very specific family nucleus. For instance, if you have a pet, for instance, a dog, and you take your dog out for a walk, and they do their business, clean it up. That's a very easy One Health action. The city I used to live in actually had signs outside that said, please clean up after your pet. And then it listed reasons why. And it said, you know, this can pollute the waterways, and this creates a healthier environment for us all. Like these are easy steps. Or, you know, having signs for washing your hand, like there are sometimes very, very easy solutions, very simple solutions that we all can take part in. Another thing for, you know, the global north that's very easy, and for global south as well, is if you have a pet, taking it to the vet to get their annual vaccinations to make sure that they're healthy, so that they don't make you and your family sick. Just some very simple solutions. But, you know, on a large scale, I know climate change is a big one. Disease surveillance is a big one. You know, that the whole wildlife welfare and surveillance, like I was talking about, environmental conservation and protection. These are all things that the global north is also interested in, and has the capability to take part in. It's just, you know, a matter of whether or not we will.
Yeah. Thanks, Emily. I've got another question here for you. Are the church medical institutions also dealing with One Health approach? I noticed Josue had mentioned that his group was discussing the relationships between, you know, the church's entities and health and education. So do you know whether the church's medical institutions are also dealing with One Health approach, and perhaps where we could cooperate as ADRA?
That's a really great question. I don't know. When I was in graduate school, I attended Loma Linda University for public health, and I do remember learning about planetary health, which is a very similar approach to One Health. It has more of a you know, environmental planetary focus, but that was very, very briefly taught. And that was at the university itself. It wasn't at the hospital that I know of. So that's a very good question. I don't have the answer to that. And so that's just another example of how we need to be talking more together so that we can understand where the gaps are. But yeah, I don't know. I would love to. I would love to know.
Yeah. Yeah, thanks, Emily. I have one more question. I know that this came up in one of the challenges that at least one group had raised, and that is in terms of donor and maybe say government donors. Do you know, and I know that you will speak from a US government perspective, but this may be relevant for others as well. Do you know whether there is an increased or increasing donor appreciation for One Health and interest in funding One Health opportunities?
Yes, there is, especially now that COVID has taken place. One Health has become at the forefront of a lot of conversations, especially at the beginning when we weren't, where did this virus come from? We don't know, and trying to figure all that out. There's been a lot more discussion around One Health, and in the United States, where I'm based, our USAID, our donor agency, governmental agency that we get lots of funding from, actually also discusses One Health. We've even had projects where they've specifically requested us to incorporate more One Health, more of a One Health approach. So this is definitely, and I don't know all of the donor agencies out there and what their priorities are, but it is something that's growing, because again, there's more and more recognition of this, more and more seeing that this is definitely something worth our time and energy. And so I would encourage everyone to look into it, see what, if your countries have a policy. Again, the United States just recently passed a policy for One Health, and a lot of countries have done that. And so sometimes we don't hear about it as much, but it's there, and it's just something that we need to look into, continue talking with our donors. We can make the case for it ourselves, talk with them and tell them we want to include this part of this specific approach in our project because blah, blah, blah. Really defending and justifying our reasoning to pique their interest even more.
Yeah, for sure. Look, I just want to thank you, Emily, for the time that you've invested into this webinar. I found it personally really fascinating. The presentation's been really clear, it's been concise, and I think you've articulated it really well. And I am sure that I can thank you on behalf of all of the participants for not only giving us some ideas, but helping us to understand One Health and in particular how we can incorporate it into the work that we do in ADRA, particularly in the COVID context. So thanks, Emily. Thank you, each of you, for participating, for attending. As we mentioned earlier, this webinar has been recorded and that recording will be made available. So you can not only listen to it again, but you can also share it amongst your network. Thank you, everybody, and have a lovely day wherever you are in the world.
Thank you, Victoria. Thank you, everyone.
Thank you, everybody.
Thank you, everyone.
Thank you, everyone. Bye.
Yeah.
Thank you, guys.
Thank you all so much.
Thank you, everyone. Bye.